Nowadays, what we were doing back in the early and 90s, we would actually harvest larger groups of follicular units with a large punch device oftentimes, or as a strip technique. And now with the NeoGraft system, what it offers the advantage is that the device uses a very small punch, sometimes as small as 0.8 millimeters, so really tiny. Use loops to do the procedure, and it will harvest the follicular unit out, and then takes a follicular unit and immediately places it into a saltwater solution, a bathing solution, so it doesn't dry out or desiccate. And then and there's very minimal manipulation of that follicular unit, and then actually we'll use those follicular units and transplant them into the bald or the recipient areas. So the advantages for the NeoGraft are number one, that it's much less invasive than the older strip technique or the older manual FUT or FUE techniques. Second of all, there's much less manipulation of the follicular units of the bulbs, of the hair follicles, and what that means is a very high graft survival rate of anywhere from 95 to 98% of those follicles that we harvest and transplant will grow and grow permanently. Third of all, it's a more superficial technique, so it doesn't invade deeper into the tissue. There's much less discomfort for a patient, because we've had patients that came in, they had a strip technique, and they were like, God, I'm a little nervous. It wasn't that great of an experience from before. And after they've had our procedure, they're like, wow, that was pretty easy. It wasn't bad at all. And then finally, there's really no perceptible donor scar. And that's important for patients. As you know, men especially tend to wear their hairstyles today shorter. We'll see some military patients. And so you don't want a scar going across the back of your head if you can avoid it. And the problem with the manual techniques that were used before, and certainly the strip technique, is you were much more likely to get a scar that was noticeable, kind of from ear to ear on the back of the head. And with the scar would also cause some thinning of hair around the scar and make it even more noticeable, and also help to deplete the donor area. We're trying to maintain maximal preservation of our donor area because we want the hair to grow naturally and thick enough in the back area so it avoids any thinning out. And then we can also go back and harvest later on. And then also, I think our survival rate for grafts is so high, Lacey, because there is minimal manipulation, and those follicles are immediately brought into a saline solution. We know from studies that if follicular units or grafts are left to dry out, then their survival rate's reduced.